Hello and welcome to Chesterfield Royal Hospital Arthroplasty Unit. You've chosen to have your joint replacement with us and we're going to help you to get prepared for your stay and your discharge home. What is a total hip replacement? A total hip replacement is an operation to replace the worn hip joint. The joint has two parts, the hip socket and the ball or head of the thigh bone. Why are you having a hip replacement? To improve your mobility and reduce pain to give you a better quality of life. It's important for you to prepare for your discharge home before you come into the hospital. You are expected to be home by day 2 after your surgery, so planning and preparation are key. Prior to your surgery, you'll have an appointment with the arthroplasty nurse specialist to help you prepare for your joint replacement.
My name's Lorraine Sanderson. I'm the arthroplasty nurse for Chesterfield Royal Hospital. We're the point of contact for you throughout your patient journey, from when you're told you benefit from a joint replacement to the end of your treatment. You'll meet us prior to surgery as part of your preparation. At your appointment with us, we'll perform a number of assessments in order to help us determine your fitness for surgery. We may refer you to our orthogeriatrician if you have medical conditions that need stabilising. One of the assessments we perform will look at your individual risk of having an episode of delirium after your anaesthetic. Delirium is more commonly known as an acute confusional state. This can happen to anyone undergoing major surgery. There are other factors that can increase this risk, and during our assessment we'll look to identify if these are present. We can then put a plan in place to attempt to minimise these risks. We'll contact you within 2 weeks of discharge to establish how you are managing at home and if there are any issues.
You will be contacted by a member of the therapy team prior to your admission. They will advise you of any equipment you may need and arrange delivery of this if requested. You will be advised of exercises to do before and after your surgery. You'll also be encouraged to use the time before your surgery to arrange any help you feel you may need, as you will be expected to go home within 2 days of your surgery. Please practice using your walking and dressing aids prior to coming into hospital. You need to have arranged for someone to help with your shopping, and it's a good idea to have some meals in your fridge or freezer ready for when you get home. Please also arrange who will be taking you home after your operation. They need to be available from the day after your surgery. Check your stair rail is secure. If not, you will need to get this repaired. If you do not have one, we would advise you get this fitted before you come in. Remove any rugs or trip hazards from your home. Move frequently used items in your kitchen to a place where they are easy to reach. If you have any pets, please arrange for someone to help you with them. You may be required to wear anti-embolic stockings and have a daily injection or tablet to reduce the risk of DVTs. You need to arrange for someone to help you to change the stockings and will be shown how to give yourself the injection while you're on the ward should it be required. Failure to arrange this help before you come into hospital may result in your surgeon cancelling your operation. You'll only need to bring a small bag. We suggest these are the things you will need. Good footwear with backs on the shoes. Medication. Any dressing aids and walking aids you have been given already. Loose, comfortable clothing. You will be getting dressed every day. A dressing gown to wear when you walk to theatre. Glasses, if worn. Hearing aids, if worn. Something to read and music to play during your surgery. Your admission. You will be admitted to hospital on the day of your surgery. You will receive a letter with the details of this prior to your operation date. Please read it carefully and follow the instructions. If these instructions are not adhered to, your surgery may be cancelled. You will be seen by someone from anaesthetics to discuss the type of procedure you will have. You will also be seen by a doctor who will discuss your surgery, and nursing staff will look after you until you walk to theatre. After your operation. It is your responsibility to start your deep breathing, cough and circulatory exercises. These will be demonstrated later in the video. As soon as you are able, you'll be given something to eat and drink. When you return from theatre, you'll have a dressing on your hip. Rehabilitation starts straight away, and we will aim to get you out of bed as soon as possible after your surgery, to put weight on your operated limb and use it straight away. When you need to pass urine, you'll be getting out of bed to do this. You'll get your regular pain relief as prescribed, however, it is your responsibility to let the nursing staff know if you need any more. Your rehabilitation. We expect you to be out of bed, washed and dressed for your breakfast, ready for your rehabilitation to continue. The Trust encourages patients to get out of bed and into their day clothes as early as possible in the day to help their recovery. For more, see our End PJ Paralysis information video. A member of the therapy team will come and assess you walking with an appropriate aid and will advise you when you are safe to walk to the toilet on your own. You need to take responsibility to complete your exercises regularly throughout the day. These will be demonstrated at the end of the video. It is normal to expect some swelling and you can help to reduce this by mobilising. It is important that you move and use your limb regularly. If your pain is limiting this, please ask the nursing staff for more pain relief. The aims for discharge are: independently get on and off the bed, chair and toilet. Be independent with all your exercises. Have awareness of pain and swelling management. Be safely mobile. Independently be able to go up and down stairs or steps safely. Here are some top tips for your hospital stay. Prepare for a short stay in hospital. You'll be expected to be home within 2 days. Arrange any help you think you may need prior to coming into hospital. Do not wait until you are in hospital to do this. Practice exercises and using your walking or dressing aids before you come into hospital. Take responsibility to do your exercises and to ask for pain relief or ice whilst you are on the ward. Follow advice given by the ward and therapy teams. If you have any questions, please speak to any member of the arthroplasty team. These are the exercises before and after your operation. Ankle circulatory. Circle your ankles and pump them up and down. Repeat this regularly throughout the day, aiming for every 10 to 15 minutes. Static quads. Press the back of your knee of your operated leg onto the bed as firmly as possible to tense up the thigh muscle at the front of your leg. Aim to hold this for 3 seconds and relax. Glute squeezes. This exercise aims to engage the muscles in your buttocks. As demonstrated in the video, squeeze your buttock muscles together as tightly as you can and aim to hold for 10 seconds. Knee bends. Slide your heel up the bed towards your bottom, bending your knee as far as you can tolerate, but not beyond 90 degrees. Hip abduction. Take your operated leg out to the side and back to the centre in a slow, controlled manner. Progression and post-op exercises. Hip abduction in standing. Stand straight, holding onto a solid support. Put your weight on your good leg and lift your operated leg out to the side in a slow, controlled manner and then lower it back to the start position. Try to remain in an upright position and keep your foot pointing forwards during the movement. Hip flexion in standing. Stand straight, holding onto a solid support. Put your weight on your good leg and lift your operated leg off the ground as if you're stepping onto a step. Bend your hip and knee, however, not beyond 90 degrees. Hip extension in standing. Stand as before. Take your operated leg backwards, whole, keeping your knee as straight as possible. Clench the buttock and lift the leg in a controlled manner rather than swinging it back. Make sure you do not lean forwards. Heel raises. Stand tall with your weight distributed evenly through both feet. Rise up onto your toes in a controlled manner and return to the starting position. Knee bends in standing. Stand as before, place your feet hip width apart, aim to keep as upright as possible, keeping your weight evenly through your heels and lower down to a comfortable point. Aim to do all of your exercises at least 3 times a day. Repeat each exercise 10 times. Walking with a Zimmer frame. Place the frame in front of you and ensure there is sufficient room between you and the frame to step. Always step your operated leg first. Share your weight through your arms on the frame and then step your unoperated leg. Repeat this process. The same process is repeated with crutches. It is important that you do not bend forward or lift your knee up in sitting. Bend your hip past 90 degrees. Do not cross your legs and do not twist when sitting or standing. Dressing aids. You'll be issued with a grabber and a long shoehorn. Use the grabber to hold the waistband of your clothing, turn the shoehorn upside down and use the hooked end to hook around the waistband. Lower the grabber and shoehorn and put your operated leg in first and then your unoperated leg. Pull up the item of clothing to your knees, then discard the grabber and shoehorn and stand up. You can then pull up the clothing with your hands. To remove an item of clothing, in standing, push the item down to your knees, sit down, then use the grabber as shown to remove the item of clothing from your unoperated leg first and then your operated leg. Steps and stairs. To go down the stairs, put your crutches in one hand and hold onto the handrail with the other. Put your crutch down onto the step and place your hand a short way down the rail. Step down with your operated leg followed by your good leg. Repeat this process all the way down the stairs. To go up the stairs, put the crutches into one hand and hold onto the handrails with the other hand. Step up with your good leg followed by your operated leg. Repeat this process all the way up the stairs. If you do not have a handrail, repeat the same process, however using 2 crutches as demonstrated in the video. Getting into and out of a car. You'll need to travel in the front passenger seat and get in the car at road level. The seat will need to be pushed back to allow you more room to bring your legs into the car. Once the door has been opened, turn so that your back faces into the car, place your operated leg out in front of you, place one hand on the frame of the car, not the door, and one hand on the back of the seat. Sit down onto the seat and then bring your legs into the car. When getting out of a car, turn in the seat and bring your legs out, then stand using the car frame and seat for support, not the car door. Please find contact details for members of the arthroplasty team in your information booklet given to you in clinic. We look forward to meeting you.